We're hearing a lot about the Affordable Care Act lately, but most of us still have lots of questions about just how it will work. It was created to give everyone access to health coverage they could afford. But it's not going to work that way for thousands of people in Virginia because they fall into what experts are calling the Medicaid gap.
Didn't have work, I didn't have anything, I didn't have nothing to cover my butt with.
After 59-year-old Andre Sokol lost his job a few years ago, he was left without health insurance. A big problem when he ended up in the hospital with a heart attack last year.
The surgery for the heart was somewhere close to $180,000.
Sokol says he's still without work and insurance, and now he's knee-deep in medical bills he can't pay. He was hoping the Affordable Care Act would help him get the medical coverage he so desperately needs, but it turns out he falls into Virginia's Medicaid gap.
So essentially we have the most vulnerable people in Virginia left not making enough money to qualify for the premium subsidies that are available through the new federal marketplace, but are also left out of our current meager Medicaid program.
Massey Worley is a policy analyst with the Commonwealth Institute for Fiscal Analysis. He says the problem's complex. The Affordable Care Act was created with the idea that all the states would expand Medicaid eligibility to everyone with incomes below the federal poverty line. Almost everyone else within a certain range would get a subsidy to help pay for individual insurance plans. But no one accounted for one thing, the Supreme Court's decision that said it was up to each state to decide whether to expand their Medicaid program. Virginia decided not to expand, and that left at least 200,000 people to fall into the gap.
Virginia, to start with, has one of the lowest eligibility thresholds for Medicaid in the country. So we actually stand to gain the most from expansion. However, the lawmakers in Virginia have decided that they are not going to expand Medicaid, which leaves many people uninsured.
Right now in Virginia, to qualify for Medicaid, a family of 3 would have to earn an annual income of $6,000 or less. In order to get a subsidy to purchase insurance on their own, that same family would need to earn at least $20,000 a year. So all those people in between don't have any options for help.
It's very frustrating because I just don't know what to do with it.
Single individuals like Andre Sokol won't qualify for Medicaid unless they're blind, disabled, or over the age of 65. It doesn't even matter that he doesn't have an income at all. He says he's just thankful that he has options like the Arlington Free Clinic. Without the volunteer doctors here, he could be left without any care at all.
I'm always hopeful for the change, and I don't see why everybody doesn't have health care.
One reason that Virginia lawmakers voted against Medicaid expansion is that many of them are opposed to the Affordable Care Act, or Obamacare, as some people call it. And Virginia has tried to challenge it in court, but advocates tell us they're hoping the Virginia General Assembly will reevaluate this next year. Maryland and D.C. are expanding Medicaid, so they won't have that gap like Virginia.